So I get this asked in the office so often, which I think we should just bring up. Everyone wants whoever wants a reduction, they want the lift at the same time. And it is part of the surgery. It's the
Yeah.
same thing. When we do a reduction, we're removing breast tissue and we're removing skin, and we are also repositioning the nipple so it's at the center of the breast.
Breast surgery Q&A. We are talking small reductions and getting you back to the gym. This is Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm board certified plastic surgeon, Dr. Ashley Amalfi, and I have my good friend, Dr. Smita Ramanathan, board certified plastic surgeon, joining us from Jersey. Hi, Smita.
Hi, Ash. Hi, guys.
This, you guys, is episode 3. We are diving into your Q&A, which we've never done before. So we're looking at all the questions you guys post on our YouTube channel, and we're literally just going down the line and asking them. There's a lot of breast ones, so we picked the best, and we have a few more. So, let's just
Huh.
dive into it.
Yeah.
So the patient is asking, I think, about a small reduction. And she said, if I'm getting a small reduction with a lift, she said a lift of care. I don't know what that means. I think just a lift.
I think just a lift. Yeah.
Okay. Do
Yeah.
you have a discussion on just getting a small reduction with your lift? Just one size. Like I want to go from a C to a B or maybe a really big A.
Yeah.
So she's already moderate breasted and she wants to be honestly pretty small. And
Yeah.
so if it's a little change, do you want to talk about, a lift with a small reduction? That's what I
Yeah.
call it.
So, yeah, I mean, I think so. First of all, so I get this asked in the office so often, which I think we should just bring up. Whoever wants a reduction, they want the lift at the same time. And it is part of the surgery. It's the
Yeah.
same thing. When we do a reduction, we're removing breast tissue and we're removing skin, and we are also repositioning the nipple so it's at the center of the breast. And that's really what's going to be your lift.
Yeah.
And
You make
with
it
the,
look cute.
yeah, we want it to be perky. We
It's
want it to
not
be,
gonna small and
and
hang.
droopy. Yeah, exactly. And
It's
then
always
with
pretty. We always make it pretty.
Exactly. Um, and then with the lift, we're doing the same thing, except we're not removing as much breast tissue, right? So if we're
Yeah.
just doing a lift, we're repositioning the tissue, we're removing the extra skin, but we're still repositioning the nipple. So yes, we can do a lift with a small reduction. Oftentimes we do that for symmetry, or if this person in particular is a C and wants to go down to a B, even those 1 cup reductions, sometimes you can get just with the lift, right?
Yeah.
Because you're shortening the breast and making it perky, that it doesn't take up that much space in your bra, right? You don't have to
Mhm.
fold up your breast to fit it in
Yeah.
there. So even though we're not removing breast tissue, you still get a little bit of a reduction in cup size. But yes, that's sort of the beauty of what we can do. We can really, there's a gradient, right? All reductions aren't big, all lifts aren't these huge lifts. we
It's like a
we can sort
spectrum.
of yeah, there's a spectrum, and we can really, and sometimes we're not doing the same thing on both breasts,
Yeah.
right?
Yeah, think of it like a reduction and a lift are kind of the same thing. Like a lift is you're getting lifted and we're taking away as little tissue as possible. And a reduction, you're getting a lift, but we're taking more tissue. And you can be anywhere along that gradient. And sometimes one boob is going to stay exactly the same. And then the other boob, you want it to get a little smaller so that they're equal. So we really play around with that. I mean, pretty much every lift I'm doing, I've got the patient's photos up in the operating room. And I'm looking at these very specific views to see, okay, is one a little bigger than the other? Because if so, I want to make sure that I take just a little bit more breast tissue off the big side and get them a little bit more symmetric than when they showed up, which is always our goal. And you guys are usually good at telling us which one is a little bigger too. But
Yeah.
you can go down no cup size, 1 cup size, 3 cup sizes, right?
Yeah. Yeah, it is a total gradient. And the thing I always like to ask them, because we never assume, that you like the same breast that we might like, right? And so when there's
Mhm.
such asymmetries, I always ask, which breast do you like? Because that's the one that
Yeah.
we're going to try to match, right?
Yep.
That's really specifically for asymmetries. But yes, there's such a gradient. And we can do as little or as much as you need to meet your goals. Cool.
That's
All
helpful.
right.
Lift reduction thing is really helpful for you guys because it's like it's the same.
It's the same thing. It's the same thing. Just one
Yeah.
is a reduction. All right.
Yeah.
That's really it.
Yeah.
The incisions are the same, all of that. All right. When can I start doing assisted pull-ups? So this is such an important question.
Perfect.
I love this because our patients are always so active, right? And like I think that's the part. Yeah, assisted pull-ups. Like
I
that's
mean, I still need a little assistance with a pull-up, but I'm really close.
yeah.
It's really good. So I assume that they're asking about this specifically after breast surgery, and so
Yeah.
I think it depends a little bit about um, did they go under or over their muscle?
Mhm.
Okay. And so I think if their implant is under their muscle or dual plane, partially under the muscle, I think you want to wait a little bit longer. And ultimately, you might not want to do chest exercises at all because when you're flexing your pec, and again, this is mostly, an arm activity, but you're engaging your chest too. Every time you flex your pec, your implants are getting squished out to the side. So if you have an implant under your muscle, you might want to sort of rethink something as aggressive as a pull up. And so, but if your implants are on top of your muscle, I think when you're fully healed, you absolutely can do chest exercises and pull ups.
Yeah.
And I would say to activate that exact muscle, my advice would be if you're on top of the muscle, I don't know, somewhere between 1 and 2 months.
Yeah, I do right smack in the middle, 6 weeks, and then
There you go.
yeah, right in the middle, and then gradually return. I mean, you guys have to remember, you've had surgery, your body is adjusting to these implants, you should not just sort of jump back into what you were doing beforehand. We have restrictions for you for that first month, 6 weeks, and then after that, your body will, right? And so
Yeah.
even though you might wanna be doing those pull-ups or push-ups or bench presses or whatever you guys do or burpees or whatever it is, listen to your body and take it slow.
Yeah, so like a ramp up. So if you do assist, so here's an example. Like if you do regular pull ups, amazing. I can't, but you do pull
Yeah.
ups, then you start with assisted, and you start with like a larger assist if you're doing it on a machine, and then you kind of gradually reduce that until you're back lifting your own body weight, and so you just kind of take it day by day. And honestly, you can sometimes advance really quickly
Okay.
and, you'll just know. You'll know how it feels, you know how you feel the next day, and that's it. And if you feel good, that's cool. You're not hurting anything, and if it hurts, you're hurting something.
Yeah, exactly. So back off and try
Yeah.
again later. Yeah.
It's pretty easy. If it doesn't hurt, cool.
Yeah. This is not the time to push through the pain. You're not proving
No.
anything to anybody. You don't need to be tough, just
You'll
sort
get
of listen
there.
to your body. You'll get there when your body is ready for you to be there.
Cool.
All right, Ash, I think those are all of our breast questions.
Love it.
3 episodes. So make sure you guys go back and look at our previous 2 to get all of your questions um, on breast surgery. So we're going to be back because we
Cool.
do have more Q&A, except we're just moving on to different surgeries. So this is really exciting and we'll
Cool.
see you next week, right?
Follow, subscribe, and yeah, we'll see you next week. Ask questions because we'll keep doing this.
Yeah, definitely comment, ask questions, and we'll see you guys next week. Bye,
Bye, guys.
Ash.